John Zeller. I've spent the last 40 years in healthcare, spent 20 years in the acute care setting, and most recently 20 years in the clinical setting, where my recent role was Director of Facilities and Support Services for Prevea Health in Wisconsin. My staff loved OneEvent. First of all, many of the technicians were able to sleep through the night. And I know that sounds funny, but when you have a technician who's working an 8-hour day, goes on call, and then he spends 6 or 8 hours at night chasing down refrigerators, they were frustrated. What we found with OneEvent is that by having the data accurately, by having the technicians being able to access the data on their smartphones, they didn't have to go into work. They didn't have to needlessly move vaccines and medications. We've had several saves. We actually had a refrigerator unit that was starting to show larger swings than normal. We were able to determine that we actually had a compressor that was failing, and so we were able to take that compressor, have it changed out without ever having a temperature excursion. And as most of us know, those excursions happen in the middle of the night, so we basically were able to avoid that, get it taken care of during normal business hours, and save the overtime costs as well as the medications that were in that refrigerator. OneEvent would provide you as a facility manager or as a clinician the capability to rest at night knowing that your product is being monitored. It monitors it continuously 24 hours a day, and if it detects that there is something wrong, we'll send an alarm to someone who can respond immediately. In addition, OneEvent has the cloud service, which allows you to go back and historically look at each individual unit and start to analyze that unit to determine how that unit is operating and when it may fail prior to the actual failure occurring. And lastly, I think the one thing that OneEvent does is it provides the opportunity to begin to look at your units, determine a life cycle cost for that unit, and when is the time that you actually have to replace that unit versus just repairing it, because you're seeing the number of excursions happening on any specific unit. The costs are not exorbitant. The cost of an excursion, the cost of your reputation as a healthcare organization, you can't get back. So the minimal cost to have the flexibility, to have the peace of mind is well worth it.